I'm Lonnie and I'm the CEO of Metal. We're here to take you through connected care with HL7 Fire and take you on our patient Stefan's journey through his care and through technology. First, we're going to show you a provider who's new to an IPA. This is Stefan's new PCP, and he's one of 30% of providers that is disconnected from any HIE. We're going to install Metal as a print driver and print his records directly as Fire resources. Next, we're going to show you EMR Direct. They represent a health information exchange. With our health information exchange, they're able to serve up CCD as a Fire-based resource. We're able to ingest it and generate additional resources from it. Over here, we have a center of excellence represented by Epic. In this case, they have their own native Fire server, and we're able to take those resources, combine them all together, and generate modern Google-style search so that it's easy to access and understand Stefan's care. Last, we'll talk to you a bit about patient consent and how Fire resources help us manage the patient's rights. First, over here to Open EMR.
Hi, thank you, Lonnie. I'm Dr. Johnson, Stefan Garcia's primary care physician. For my health records, I use Open EMR, an open medical system. I've just recently joined an IPA, an Independent Physician Association, and I need to share my records with them. Whereas traditional ways I may have had to fax that information, I can now install a Metal print server, print driver. It installs in less than a minute. And this will allow us to safely and securely upload my patient data for Stefan Garcia to Metal's Fire-based servers. For Stefan Garcia, I'm going to enter a diagnosis of hypertension and COPD as a medical problem. And I'm going to generate reports. And using the print driver I just installed, I'm going to print and upload my report to Metal's Fire servers. We can see that the print driver here extracts a possible patient ID from the data. I agree that this is his primary medical record number. I click on OK. And at this point, the report will be uploaded to Metal's Fire-based servers. We could see a successful print message indicating that the delivery is complete. Now, unfortunately for our patient, Stefan, his condition worsens, and months later he develops a bad cough, has problems breathing, and needs to be admitted to an emergency room. And here to take us through the next step of Stefan's journey is Louis from EMR Direct.
Thanks, Lance. So as Lance said, Stefan does get sicker, and he does have a fever and cough that just keeps worsening, so he decides to go to the local emergency room in his town. The emergency department has a relationship with the IPA where the PCP participates. So Dr. Seven, his emergency room physician, is able to use the EMR Direct Health2Go Fire client to access the records from the IPA's Fire server. He sees the available documents, including the summary visit from the visit 3 months earlier, and is able to review that information, including his history of erythromycin allergy, smoking history, and other factors that will play into his care in the emergency room. So Stefan is admitted overnight for observation and treatment for pneumonia, but unfortunately he continues to worsen, and his fever spikes, his respiratory rate increases, he's breathing more shallowly, and the physicians are concerned that he is becoming septic. The decision is made that he needs to be transferred to the university in the next town over for ICU level care because the hospital where the emergency room is located does not have an ICU. Although they don't have an ICU, they are, however, Fire enabled. The hospital is using EMR Direct's Fire as a service to provide the documents from the discharge summary and other documents from the hospital via Fire to the IPA. So the IPA's Fire client can query those records and bring them into Stefan's unified record that they are holding. So when the patient is discharged and transferred via ambulance to the university, his records, including the discharge summary of the hospital from the emergency department, are already available for use later on in the scenario, as you'll hear about next.
So Stefan is now at the university hospital. His condition keeps worsening, and naturally they run a number of diagnostic tests, including a basic metabolic panel, x-rays, and even a lung biopsy. Unfortunately, Stefan is diagnosed with lung cancer. Now, the university hospital is a center of excellence, and they use Epic to manage their medical records. Fortunately, Epic has FHIR capability, which means that Stefan's information will be available to his entire care team once he is discharged. Now, among those diagnostic tests that were run, I would like to highlight two of them, which are technically interesting. The first of them, the basic metabolic panel, is composed of highly structured information. In fact, Epic internally uses HL7V2 and exposes that as FHIR resources. The other test that I would like to highlight is the lung biopsy. This also gets captured as a diagnostic report and exposed as a FHIR resource, but it contains highly unstructured information in the form of a narrative with the pathologist's observations and the conclusions. Now, as I was mentioning, once Stefan is discharged, his entire care team has access to his information. So now let's get back to his primary care physician for him to get to know what is happening with his patient.
We're now going to search and summarize all of the medical information that was captured throughout this patient journey. Let's go ahead and log on to the MEDAL Search and Summary application, which is hosted using Smart on FHIR. Here we see a Smart on FHIR logon. Smart has the benefit that we can launch this application in existing electronic health record systems, such as Epic, or even make it available to clinicians in an iPad. Let's first look at Stefan Garcia's visit history. When we look at the visit history, we see that there is the record from the primary care physician. There is also the record using existing HL7 CDA standards that we get from the existing health information exchange, as well as the biopsy and the basic metabolic panel that were made available using JSON resources. Let's go ahead and do a keyword search, and let's search for albuterol. Albuterol is important because Stefan Garcia has COPD, and albuterol is a medication that relieves those symptoms. Importantly, our match shows that we match also the name Preventil. Preventil is returned as a result here because Preventil is a brand name medication for the albuterol drug. Next, let's go ahead and search for high blood pressure. High blood pressure, of course, is a clinical synonym for hypertension. Our search system here knows that those are clinically synonymous because we use a wide variety of electronic medical record vocabulary standards, including SNOMED, RxNorm, and others. Let's do one more keyword search for heart attack. And I bring up heart attack here because that's how a patient might refer to it, whereas myocardial infarction is how a doctor might refer to it. And here we see again that the ER was unable to rule out an MI or unable to rule out myocardial infarction. And with that, I'll turn to Delise Brandman, our medical officer.
Thanks, Andy. So the first four stations have shown you the provider view of how the MEDAL platform can cause data to be shared and utilized as a whole story of the patient. When Stefan first went to visit Dr. Johnson, who is a member of the IPA that has signed up to use MEDAL as an integration platform, he suggested to Stefan that he also consider signing up for the personal health record. The personal health record allows Stefan a view of his total data history and storage, and allows him to customize it as he sees fit. We believe, as MEDAL and myself as a physician, that having a patient have their own data and a view of their own data, being able to contribute to it and interact with it, is critical to their engagement in their own health and improvement of their care and their lifestyle over a period of time. But we also know that there are some specific areas that need to be considered as you move into the PHR world. Today we want to introduce you to three parts of how we support that PHR. The untethered PHR, which is all of his data over the community, not tied to any hospital or any proprietary EMR. So first we achieve consent. We know that for doctors participating in Stefan's care, they're not required to have his consent, but as soon as we move beyond that trusted circle, it is required to get Stefan's interaction and his permission to move his data across institutions. So We first of all register Stefan. As he registers and then clicks the approval button, we take him to a DocuSign form. DocuSign is a new way of getting electronic signatures. It's fully legal and accepted, so we create that here. That allows us to create a letter, permission letter, so that we can request Stefan's records at any time. But just getting the information is not enough. So we support him in a second way. Having access or allowing access to his records is it's important he control where it goes, what doctors, over what period of time, and even what information. So we give him a series of settings that collect that information. So he can, first of all, allow us to retrieve it. He can tell us how long we can store it, and for what time, and when to share it and when not to share it. So on top of this basic services, thirdly, we also offer some additional services. One that will be particularly important to Stefan now, since he has a new diagnosis of cancer. So this information can be used to check Stefan's qualifications for clinical studies. So as a patient newly diagnosed with lung cancer, it will be important for him to understand his options to enter a trial for his initial therapy. So we ask him if he wants to participate in that trial, and he does decide to do that, and he's matched with 2 trials. So that information then will become part of his record and available for his primary care physician to discuss with him. In addition, he can do other things like donate his data to approved resource, and so those are the additional options that we offer. So hopefully you've enjoyed his journey in spite of the fact of his continually deteriorating care. And I'll turn it back to Lonnie.
Thank you. So we followed Stefan on his journey, and we've looked at the evolution of technology from disconnected providers to health information exchanges and to centers of excellence, and what is enabled through Metal and Smart on Fire. We're excited to share this with you today. These are familiar business models, new technologies that enable them. Thank you.